Hello dear learners, in today's video lecture we are going to cover the terminology that is malaria. Now as you all know, you have studied anti-malarial drugs, so terminologies are also important when it comes to exam point of view. So terminology includes the answer like what is malaria. So it starts with definition, then symptoms. So we will start with the definition now. As you all know, malaria, it is a disease of tropical or subtropical region. So it covers various countries which comes under tropical or subtropical regions. So the countries like India, Indonesia, okay, southern regions of like Africa, America, etc. So it is a disease of tropical and subtropical regions, the regions which I mentioned, and which is caused due to 4 types of plasmodium species, which are as follows. The plasmodium species are Plasmodium falciparum, or it can also be written as P. falciparum, then Plasmodium malariae or P. malariae, Plasmodium vivax or P. vivax, and Plasmodium ovale or P. ovale. So these are the species. There is one more species, but these 4 species are important as far as the malaria is concerned. So this is a disease of tropical and subtropical regions which is caused due to these type of plasmodium species, and this disease is transmitted by the bite of female Anopheles mosquito. Now this plasmodium structure, this is the parasite which causes malaria in humans. Now there is one interesting reason behind it, why only female mosquito transfers the malaria and why they only need blood. They need blood for the nourishment of the eggs. So female Anopheles mosquitoes, and there are many reasons, like so female Anopheles mosquito, that too it is a plasmodium parasite which causes malaria, and affected areas like which we discussed, tropical and subtropical regions like tropical countries such as India, Indonesia, Brazil, etc., and subtropical countries like Australia, Southeast Asia, America, etc. So this cycle, life cycle of malarial parasite we have discussed earlier in detail in the video of anti-malarial drugs, and that too life cycle of malarial parasite separately topic we have discussed. Just to just to give a brief overview, this is a Plasmodium sporozoite. There are various forms of this Plasmodium parasite. Like sporozoite is the major form which is released through the saliva to the body cavity, and the sporozoites will enter into the host. The sporozoites, when enter into the host, they will, after injection into the person, they will infect the person, and the person's organs such as liver gets infected. So there are 2 forms majorly, exoerythrocytic form and erythrocytic form. So exo means this is outside the erythros, that is RBCs, so it is liver and infected red blood cells. So these are the RBCs. There are forms from the merozoite to trophozoite, okay, and then this RBC is erythrocytic form. On maturation, like from the entry into the mosquito, this mosquito, what will do, that mosquito will bite, and it will enter, means by sucking the blood it will enter into the mosquito, and again this mosquito will bite to the another person and it will infect some other person. So this is the complete cycle. Then coming towards the next, that is what is malaria, that is terminology includes definition along with the symptoms. So these are few of the symptoms. Like most common symptoms are like fever, headache, fatigue, nausea, vomiting, which are self-explanatory terms. Now from the images you can very well know the meanings of these terms. Like fever, see they have shown the thermometer, then headache, fatigue is there, nausea like a feeling kind of feeling like vomiting, then vomiting is there, then other symptoms such as cough, body ache is there, back and abdomen ache, then sweating, chills, diarrhea, etc. These are the common symptoms. And the severe symptoms, like severe malaria, it can cause like these things like convulsions can also be there, but these are severe form, like jaundice. How jaundice? Like convulsions like epileptic attacks. Then jaundice, it is due to it is having a strong effect on the bilirubin conjugation ability of the liver, and in turn it will increase the bilirubin, and the severe form is jaundice. Then anemia is also there, which is majorly affecting hemoglobin levels, RBCs. Then spleen enlargement can be there, swelling. Again, liver enlargement can be there, kidney failure can be there. So these are the severe forms. So these symptoms along with the definition includes the answer for what is malaria. And just to see common prevention and treatments of malaria, malaria is avoid going out at dusk or dawn, since is a female anopheles mosquito, and that at the time of dusk or dawn, that is nothing but it is in Marathi you call it as sans, like dusk is sandhyakachi sans, like at the evening time, and dawn is it is sakachi sans, like before sunrise, and also it is early start of morning. So dusk or dawn time you should avoid going out to avoid the mosquitoes, like at these times mosquitoes are more active. Then you should wear protective clothings, like so that mosquitoes cannot bite due to all that protection. Then use insect repellents. You can use insect repellents, like various repellents are available in the market, such as Odomas and all, which is the very famously known. Remove standing water at the home. Stagnant water should not be there. Wherever you will find the stagnant water, you should remove it. Then stay in places with the air conditions and window screen. Then use a mosquito net, like mosquito bed net. This is best prevention which one can take, and avoid going out at the dusk or dawn. These are the must precautions, like wearing protective, then insect repellents, etc. So all these prevention one should take in order to avoid malaria. And treatment, like as such there are no vaccines, but in 2015 or at the start of 1987 the discovery went, and in 2015 one vaccine they developed. But basically one prefers the medications, like to take the medications to prevent the malaria before traveling, and injections like tablets, injections, etc. are available. Oral drugs or intravenous injections of anti-malarial drugs. And anti-malarial drugs also we have covered along with the classes in detail, the descriptions of the drug in the videos of anti-malarial drugs. So you can go through that videos of anti-malarial drugs. As you all know, the various anti-malarial drugs and the treatment. Now this says that treatment will vary according to the type and the severity of the malaria, age, pregnancy. These are the various factors which are affecting the treatment. So this in this also we have discussed in detail in each and every drugs video. So this was with prevention and treatment. Now further to move ahead with the types of malarial attacks. If you will see these types of malarial attacks, these are the species which we have discussed in the definition, which are responsible for causing malaria, such as Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium malariae. And these are the types of attacks. Like there are types of malarial attacks such as benign attack, malignant attack, then tertian malarial attack, then quartan malarial attack. So this you can see, this is benign tertian type of attack which is caused due to the species Plasmodium vivax, and the periodicity is 48 hours, that is attack occurs after 48 hours. And this is the malignant tertian malarial attack, which is caused due to the species of Plasmodium falciparum. Here also attack occurs after 48 hours, and it is the most dangerous form of the malarial attack type. Then Plasmodium ovale, as the name suggests, ovale tertian, it is caused due to the species Plasmodium ovale, and it's a tertian form. Here you have marked one thing, that torsion attacks, the attacks are occurring after the periodicity of 48 hours. And quartian attack, if you will see, this quartian attack, which is caused due to Plasmodium malariae, occurs after 72 hours. So these are the types of malarial attacks according to their periodicity and the species. These types of malarial attacks we have covered in very short, because the question is also not asked in the exam as such, but you should know which is the most intense form, which you have just now known, that malignant tertian form, which is caused due to Plasmodium falciparum, is the most dangerous form of the malarial attack. With this we finish with the terminology, that is malaria, which is asked in the exam. And stay tuned for our next videos on terminologies. This series will include different terminologies which will cover your entire syllabus. Thank you.